I'm going to share a secret with you today that I don't think I've shared with anyone in public before. And that's that I'm not a great doctor. And worse than that, I don't think any of my colleagues are great doctors either. Now, I want to be really clear about this. I don't mean that I didn't do well in school, that I didn't get good grades in med school. I did okay. I don't mean that I struggled to pass my board exams. They were fine. I don't mean that my patients have problems with the care I provide. In general, they're extremely satisfied. What I mean is that I'm a human being. And like all the other doctors who are human beings, we're subject to 4 fundamental failings that prevent us from being great doctors. The first one is that I have emotions. I want you to think about the last time you had a really bad day. One of those days when you woke up in the morning on the wrong side of the bed, you didn't sleep well. The traffic is lined up for miles on your way to work, and you arrive late to an angry boss. How productive are you on that day? What are your interactions like with your coworkers? What are your interactions like at home when you get back home? I can't answer for you, but I can tell you what the answer is for doctors. When a group of physicians was studied and asked how they performed on a day when they felt good and happy and satisfied versus on a day when they were just down in the dumps or stressed out, on doctors' bad days, they prescribe more medications, they refer to more specialists, and they spend less time with each and every single one of their patients. Failing number 2, I'm on a tight timeline here. Doctors are pressed for time like everyone else. And what does this mean? Well, the way that physicians keep up to date in the medical literature is they read academic journals for up-to-date articles. Now, in primary care alone, there are about 7,000 articles published each and every month in reputable journals, not just counting those fly-by-night ones. Now, if we were to print all of those out and stack them here beside me, they would reach 12 feet tall. Now, there is some good news. Turns out doctors are actually extremely efficient at reading and digesting medical information. They can, on average, read a journal article every 4 minutes. At that pace, I can read about my height in journal articles. So all I need to do is find a friend, split it up, and by the end of the month, we'll be up to date on all the latest and greatest in medicine. But we won't have seen a single patient. Our third failing, we can be tricked. I want you to look closely at these 2 pictures of the same woman. In one of them, she's experiencing substantial pain and her face is reacting to it. In the other one, she's faking it. Now, if you're having a little trouble telling, it just means you're human. Even with training, the average person can only identify real pain about 55% of the time. It's picture B, by the way, for those of you who got it. Now, for physicians, this is a huge problem. In the United States, approximately 20% of all visits to the emergency room involve patients with something we like to call drug-seeking behavior. These are patients who are faking it to receive some kind of substance of abuse, often prescription painkillers. This is an epidemic in our society. 15,000 Americans die every year because of prescription painkiller overdose. Humans can't tell the difference. Fourth, I can't always be there. I want you to look at this map of the world. Now, look carefully and maybe focus towards the center. So I'm going to modify this map a little bit to show you each country represented by the number of physicians that live in it. So watch closely. Here we go. Africa's gone. What happened? It's completely disappeared. Some countries in Asia, you can't tell them apart anymore. That's because these countries are suffering severe shortages of physicians. What doctors they are able to train emigrate out and come to countries like the United States. The patients that are left behind are left to deal with their health issues with health workers with questionable training and, even where they are well trained, extremely limited resources. Furthermore, imagine people living in remote communities in our own country. How do we access them with simple human beings? So Because of all four of these fundamental flaws that all humans share, we're prevented from being great doctors. But there is hope. And the hope comes from automation, computers. Now, I know what you're all thinking. Okay, doc, like this is all really nice, but you're going to turn my health over to a computer? It's going to make the decisions? Well, we've been doing it for years. It's what lets us get into space. From the very first Apollo mission, rockets have been guided towards the moon by a computer. When the lunar module settled down for the very first time in the dust on the surface of the moon, it was guided by a computer. And for those of you who think that you could do a better job, well, please, be my guest. And we're going to remove those couple computer screens that do exist, and we're going to replace them with the few thousand switches that they're taking care of. Now, the same thing's happening in commercial airlines. The very first autopilot system in a plane was created in 1910, just 7 years after the Wright brothers' first flight. Today, commercial airlines that go on a 6-hour transatlantic flight are controlled by their pilots for just 3 minutes manually. Now, despite that limited amount of control, human error remains the #1 cause of airline crashes. The clinic environment is no less fraught with danger, is no less complex. Hidden in this simple prescription pad are even more than the thousands of knobs and switches that you would find in the space shuttle. Here, embedded in this simple piece of paper, are millions of possible medications, each with multiple possible doses, adjunctive therapies, specialist referrals, all of which need to be carefully cross-checked to make sure there are no drug-to-drug interactions. Computers can help. It's not a new idea. This picture's from 1987. This is an oncologist using the National Cancer Institute's database to look up some treatment data. And since then, I mean, we've made some progress. Physicians, engineers, designers have all been working towards advanced clinical decision support systems that are making healthcare much safer. But for all of us as patients, are we ready to embrace computers into the doctor-patient relationship? Are we ready to accept the fact that sometimes the system will fail? It will make a mistake. When Ken Jennings took on IBM's Watson supercomputer in the ultimate Jeopardy grudge match, Watson's supercomputer answered incorrectly 6 times. But at the end of it all, having just been vanquished, Ken wrote this: "I, for one, welcome our new computer overlords." The Watson computer wasn't perfect, but it was a far better Jeopardy player than any human ever could be. So the next time that you come into clinic to visit me and you see a computer sitting beside me, don't be shy. Come on in, introduce yourself, and maybe thank him for coming, because he's helping me be a little less human. And together, we are a great doctor. Thank you.